All right, well, good morning, everybody. Let's see here. Okay, so we're going to go ahead and get started. Let me just double check and make sure I stop moving stuff. So our mics okay? Those of you who have mics? Okay. All right. Oh yeah, let's do some distancing. So Counselor Mark, there's more space over there. Ryan, you can stay over there. Okay, and Danielle, are we good to go? All right, so good morning. We're here for our daily briefing. We have a number of public safety updates here for everyone today that we're going to touch on in our deep dive section. And as usual, we'll start with some updates from around central New Mexico. Then we're going to talk about some public safety issues. I think in particular, we're going to talk about nursing homes. We're also going to talk about a couple of types of businesses that we've seen some challenges with respect to the stay-home order and the business closure order. So, and I'm just making sure too, I think we're going to hear a little bit from our fire marshal on this. We're also going to hear from our environmental health department on nurses. And we do have a lieutenant here from APD to talk a little bit about enforcement. So that's what's on tap for today. So we'll go ahead and get started. So with some updates from our Joint Information Center. First, UNMH is showing support to healthcare workers through a creative sign campaign. UNMH wants to encourage residents and businesses to provide positive messaging to healthcare workers by posting them on your signs. Could be in your yard or your windows or your storefronts or on those marquees that folks have. Just thank our public health workers. Now, we also found out yesterday we had our first positive COVID-19 case in La Vidiena. We know that's one of our city's kind of stalwart retirement homes, famous, many of our friends and family. We've all known people, most of us who've been through there at different times. It has raised awareness and heightened challenges around nursing homes. This is something we know is an issue statewide and nationwide. We're going to talk a little bit about here in Albuquerque what we're beginning to do on that. We also want to remind folks that grocery store is an essential facility. And we want to remind folks, though, try and go alone if you have to go to the grocery store. We're also encouraging people to go at like odd hours. So not necessarily the normal rush times when you would go. And again, reminding folks that so far the grocery stores are being replenished and so forth. So with a minor exception of a few goods like toilet paper and so forth, they're really well stocked. So there isn't a need to line up beforehand and so forth. And we're also encouraging the stores to continue to work on their social distancing protocols inside their stores, whether it's lines and so forth. And again, our recommendation is 1 week. Buy 1 week of groceries and go once a week and then go by yourself. And it's on my to-do list as well for this weekend. Okay, on another note, our convenience centers for trash. These are our centers, right? There's one right here on the west side, Don Reservoir. There's also Montesa out on the north end of town, and then on the south end of town. On the north end of town, we have the one near Pino Yards, Eagle Rock transfer station. Want to let folks know a couple of things. It's spring. So there's always busy lines and so forth at these convenience centers. That's one factor that are making them busy. Second factor is we're trying to actually space people out accordingly. So you see the lines longer than normal for two reasons. And for more information on that tomorrow, we're going to be focusing on open space. Not necessarily parks, which we talked about earlier. We're going to focus on open space tomorrow and solid waste and spring cleanup. There's a lot of activities with respect to trash pickup, neighborhood cleanups, and everyone doing yard work and this kind of thing that always happens in spring. And so we're going to kind of talk about what that means in the time of Corona. So with that, let me touch on a few updates with respect to emergency operations at the city. First, for those of you tuning in visually, this is our Emergency Operations Center. You can see behind me everyone working, and I'll kind of explain a little bit about how this works. It's okay if you can't see the details behind me, but what we have on this screen over here is a list. That's all the resource needs that are coming in from all over central New Mexico. Like, hey, I need PPEs, I need et cetera, I need gowns, gloves, et cetera. This facility is coordinated. It's a joint center with the county, and so we work through that list. On this list, on this side, is actually more specific medical issues from hospitals that are coming in. And then we coordinate with the other emergency centers around the state of New Mexico. In the middle, right behind me, is this is our dashboard. You can see we use this for the different levels of emergency that our community is at right now. And you can see there's actually only one red box. That happens to be the rail runner. That's rail transit that, of course, is closed. That's why that's red. You see a number of areas that are green. They're up and running. That's primarily our infrastructure. So our natural gas, our electricity, our roads, these kinds of things wonderfully in these times are totally fine. And that's why you see them category as green. You see the yellow categories are the ones really focused on challenges with respect to food supply and so forth and emergency services for all the reasons we've been talking about, why those are color-coded yellow. That's our dashboard. We update this every day. And those who are tied in the emergency response community, they're all in tune with sort of how this works. We did just want to share that, we've had this facility for a long time. It was really built, I think, coming out of 9/11 and incidents that happened then. And we regularly train at this facility. As I've mentioned before, the most relevant training we did in the last 12 months was our anthrax training. So this is also where we're coordinating how we scale. So going forward, if we have to use community centers or we have to use different city facilities, the convention center for different things, this is kind of where all that happens. Now, also want to mention with respect to this, I know there's been a lot of talk about the different emergency hospitals that we're looking at putting up around both New Mexico at the state level and in Albuquerque. As the governor and the Department of Health have mentioned, lots of progress on the old Loveless facility in terms of how to use that. And that's progressing with the Department of Health and the Army Corps of Engineers. We also know that we've put in this request to the Army for an additional facility in Albuquerque. Just as a status update right now, we're in communication with, of course, our Army Corps of Engineers and with the State Emergency Operations Center. And we're in discussions on that. I do want to talk about expectations, though. Right now, there are no specific plans or sort of triggers being pulled with respect to that facility. So this is one where often it's been talked about at the convention center. So again, we're in the planning phase, we're looking at it, but right now we're being told that that is something that's probably weeks, not days, and we'll just see where we're at down the road. So that's with respect to the usage of the convention center, and again, that's different than usage of the old Loveless, which is going through the state and the Department of Health. So right now, again, just planning phases for potential usage of the convention center. Okay, now this last thing about this Emergency Operations Center, we decided actually about 2 weeks before the state orders started coming down and so forth, actually we started activating the Emergency Operations Center. So I'm very glad to say that we were a little bit ahead of the curve on this. It's great that we have the facilities and the personnel to be able to set this up, and we jumped into early action. And it's been able to really support central New Mexico in these times, and will continue to do so. Now, there's a number of things we want to touch on. I think first we're going to talk about a little bit in terms of what's happening with respect to our first responders, and then we're going to go into some of these specific areas around businesses. So what I'm going to do is pause for a moment and invite, we're very fortunate to be joined by our city councilor from this district and was city council president last year. Clarissa Pena is here with us. And before we dive into all the details of our experts that are here, we're honored to have a little bit of time, socially distanced, with our councilor from this district, Councilor Clarissa Pena. Councilor, come on up and share a few words.
Thank you, Mayor. Thank you. Before I get started, I just wanted to say something. I don't know your name. What is your name?
My name is Nixo.
Nixo. Well, I just want to thank you. I'm very about supporting people with disabilities, and the fact that you're out there spreading the word to the hearing impaired is fabulous, and I think you're doing an awesome job. I look forward to seeing you every day. So first, thanks to the mayor, and I also want to thank our governor. I think that, you know, these leaders in our community are just doing a tremendous job in terms of the coronavirus and how to address all facets of it. I couldn't even imagine. You know, I was city council president last year, and thank God Councilor Davis is president this year because he has his hands full. But I want to thank all our first responders. I want to thank our healthcare professionals, our healthcare workers, our essential employees throughout our community. I just want you all to know that you are appreciated. You're vital for our community's success in beating this virus. And we just really, you know, you guys are the backbone of our community. And with that, you know, I'm just going to make a couple of announcements because I know we have several speakers, but I just wanted to say that, you know, people who can't afford to pay their rent, we're asking for donations to the city at the Alamosa Health and Social Service Centers, the Los Griegos Health and Social Service Center, John Marshal, East Central. I'll actually take a picture of this and post it on my Facebook. There's the addresses that you can mail in a check. Obviously, we don't want you to go down to the community centers to do that, but we'd really appreciate it. As you know, it's a difficult time in our community right now. And then opportunities for our kids and families. You know, I think we're all gearing up and getting ready to kind of teach our kids at school, and we're going to become teachers, and grandparents are going to become teachers and parents. And so there's, if you have a valid library card, you can always go online at the for the city and the county, Bernalillo County Library, and get information, and you can actually check out materials via the web. And then finally, just a few resources for domestic violence, abuse, and crisis situations. As you know, those things still continue in our community, and if there's anyone out there that needs support, we have the National Domestic Violence Hotline at 1-800-799-SAFE. UNM Mental Health, which is 505-272-2800. Alcoholics Anonymous at 505-266-1900. Agora, New Mexico Crisis Center, 505-277-3013. Domestic Violence Hotline, 1-800-773-3645. Child Abuse Hotline, 505-841-6100. Elder Abuse Hotline, 1-866-654-3219. The New Mexico Crisis and Action Line, 855-662-7474. And the New Mexico Rape Crisis Center at 505-266-7711. I just want to thank everyone who's staying home and following the guidelines, and I wish everyone to stay home, stay safe, and stay healthy. Thank you. Thank you, Mayor.
Thank you so much, Councilor. Thank you. Okay, now we're going to hear a couple of updates from some of our subject matter experts. And so let me introduce them just briefly and talk about a couple of things. We're going to start off with Dr. Mark Demenna. He is our resident microbiologist or epidemiologist. It's close. But he's the sort of scientist in charge at the city right now. And so he's going to touch on a couple of things, but he's also going to talk a little bit about what we're doing for our nursing homes. We're going to have to start inspecting our nursing homes. We know that these are extremely high-risk areas. And so all of the social distancing protocol, et cetera, we know that our seniors live there. I mean, it sounds obvious, but like we understand that. But within that context, we've got to keep people as safe as we can. And so Dr. Demenna is going to walk through some of the food protocols, some of the community space protocols. And now that also we have our first case in Albuquerque, we're going to have to regularly work with them in partnership to make sure that they're following these. Because as we've seen in other states and around the country, a densely populated senior population is one of the most high-risk places really right now in the country. And we do have a few here in Albuquerque. So to talk about that, Dr. Mark Demenna. Doctor.
Thank you, Mayor. I know everyone has been hearing this consistently, and I'm going to stress it again. The most important thing that we can talk about at this time is social distancing. That's key. We do want people to stay home as much as possible. Although we recognize that people still need to buy groceries, some people still need to report to work, and there are some whose living conditions pose a greater risk to them, in particular nursing homes, which I'm going to talk about in just a moment because of those vulnerable populations. Environmental Health Department and Code Enforcement with the Planning Department are reaching out to grocers, to nursing homes, and some of the other businesses in town to ensure that they're following the public health orders that have come down from Department of Health and the governor. We're also offering assistance. One of the things that we're looking for is the kind of guidance, the subtleties that are not necessarily being conveyed right away, but that we're seeing these patterns emerge. So as the mayor just said, if you have to go shopping, it's better to go alone. We don't want large groups of people. Don't take the entire family. We want people to be spaced out. The stores have to manage the number of people that are coming in and the spacing that they have. So if you go in with a large group of people, it's very difficult to maintain that 6 feet for everyone else that's there. Be conscientious when you're out in those public areas. Remember covering your cough, covering a sneeze, doing things that aren't going to cause discomfort for other people or going to risk spreading virus if you might be infected. Might be one of those silent spreaders that we're hearing about where you're asymptomatic. The city, wherever possible, is now providing assistance with this enforcement anywhere that we can. We're doing direct communication, whether we hear complaints or if we witness or hear reports of someplace that's not necessarily meeting the spirit of the compliance. So we'll make a direct communication to a grocer or to another business and let them know this is what we're really asking you to do and you're kind of missing the point on this. If we were to see someplace that's either deliberately missing what's being asked for in compliance, not doing what's being asked of them, or maybe just a little bit off in terms of that, or if they're repeat offenders, that would be something we'd call the state in for enforcement. That hasn't been common so far, but potentially as this wears on, there's going to be more and more of these issues that come to light. So before I turn to talk about nursing homes, I just want to take a second to remind people there's been a lot of attention paid to the 60 or older segment of our population that is most at risk for very severe disease, most at risk for their conditions becoming life-threatening with COVID-19. That is certainly the case, but what gets lost in that, we want to remind people even in their 30s and 40s and younger, as we're seeing with some of the cases that are being reported even here in New Mexico, those people are also at risk of getting disease, getting an illness that can be serious, and in some cases also life-threatening. So we don't want this to just be characterized as something that only affects the elderly. This is something that's everyone's problem. And when we're talking about social distancing and staying home, we want people to remember it's not just you if you feel young and in good health, but it's the entire community that could be put at risk if we're not all doing our part. With regard to the nursing home case that Mayor referenced at La Vidiana, and there's another one that we're aware of in Rio Rancho, those are deeply concerning to us. Obviously, very vulnerable populations that live there in close quarters. We've seen in other states what can happen when nursing homes end up with a case, the compromises that can exist. So we're reaching out now to those nursing homes to talk to them about what the best practices are, make sure that they're properly reacting where cases are. We're coordinating that with the Department of Health and potentially with the hospital systems as needed. But we are, as the mayor said, we're going to have to actually go and make direct interventions, direct contact to make sure that they're doing everything that they should be doing, and the subtleties of what stay-at-home and social distancing, the changes that they need to make in their day-to-day practices aren't being lost, because we really want to make sure that those populations are protected. So again, we have a very relatively low case count here in New Mexico so far. That's encouraging, that's great news. Probably speaks some to the testing delays, but also speaks a lot to what New Mexico is doing and the sacrifices that we're all making with staying home, maintaining our social distancing. And again, personal hygiene, things like washing your hands and not touching your face. The same messages that you're hearing consistently, these are the things that are going to protect us and keep us from having the onslaught of tremendous numbers of cases that some other places are seeing. However, low case numbers, that's not necessarily a signal that social distancing is coming to an end anytime soon. Rather, it's a signal that it's having the effect that we had hoped that it would have. So that's going to need to go on potentially for weeks, potentially for longer, and the data as time goes by will tell us when that might come to an end. So it's going to be a very difficult time for people. It's going to be a lot of sacrifice, but we really want to emphasize that this is the most critical, the most impactful thing that we can do to slow down the spread of this virus. Conversely, as we will expect over the next weeks to see an increase in cases, a steady increase in cases is expected. That is what we would expect to see regardless of all of the measures that we take. It's not a sign that social distancing or the sacrifices we're making are not being effective. What we are trying to avoid and what we hope not to see is a rapid increase in cases that would overwhelm the healthcare system. So as long as we are seeing that slow, steady climb and we're able to roll with the cases that are coming in, that is the effect that we're looking at. So it wouldn't be a sign that we need to abandon that as an ineffective strategy. And that's what I have to say.
Okay, thank you very much. Now, next we want to hear a little bit from a couple of folks who work at AFR. And let me mention a few things with respect to what they're going to talk about. First, Lieutenant Fox is going to give us an update on what the EOC has been doing and touch on a few other AFR issues. And that does include reminding everyone there's no smoking in our open spaces. This has been an issue with respect to fires, and that goes for anything, whether it's your cigarette or illicit substances or anything, which shouldn't be happening anyway. But just want to be clear, we are going to heavily enforce that. So there should be no smoking in open spaces. And if you see someone doing that too, I would call 242 cops. With a little bit more on that and our Emergency Operations Center, Lieutenant Brian Fox.
Good morning, Lieutenant Brian Fox. I'm currently assigned up here as the Logistics Section Chief to the Emergency Operations Center. So I'm just going to talk a little bit about what we're doing here in logistics to support the operation of the things that are going on around the city as it relates to COVID-19. So there are a lot of things that we're doing behind the scenes that a lot of people aren't understanding or knowing the right path to go. So we're going to talk about that and get those tell you how you can get donations and things to the right locations, and then talk about, as the mayor mentioned, the open space areas of the Bosque. So currently there's 8 personnel assigned to the logistics section here at the Emergency Operations Center. The categories that are covered under logistics sections are communications as it relates to the operations of the Emergency Operations Center, transit plans as they relate around the city, resource management as we receive purchase new items, and then as we issue them out to first responders, hotels, and clinics throughout the city. So to this date, we've issued, which is the highest, most frequent item that's been issued out, is 42,875 masks through the Emergency Operations Center. So when somebody calls for masks, emergency gowns, or emergency rubber gloves, they put an order and appear to the Emergency Operations Center, and then we fill the order. We're filling orders for first responders as it relates to Albuquerque Police, Albuquerque Fire Department, hospitals, and clinics. So to date, again, we've filled those many orders, up to 42,875 masks, and we're continuing to stockpile our stock by finding means to purchase those items and whatnot. We're also working for future planning, filling locations that we may be doing shelters, but with cots and blankets, and then reaching out to any long-term logistical needs that we might have. And as the mayor mentioned, just a reminder, we're seeing an increased use of the recreation areas in City of Albuquerque open space lands. We're asking the recreators to be cognizant of what's going on, and please, if you see something, please say something. If it's an emergency, we ask that you call 911, and if it's non-emergent, please call 242 cops. Thank you.
Thanks, Lieutenant. Okay, next we're going to hear from our Fire Marshal, Gene Gallegos. And we've been experiencing throughout our city a couple of enforcement challenges with respect to this public health order. And by and large, the enforcement is, of course, at the state level and with the state police. However, we have a couple of specific challenges that we're going to be looking at in more detail. And so we're going to talk about these massage parlors. We're very concerned about some of these being illegally open, and we're going to begin citing them. So this is one. Please call those into the state hotline, and our team, our public safety team, is going to talk about that. But we are going to begin citations for them. Also, smoke shops. This is another thing we've seen. They are still open, and they're not covered under any exemption. So this is another area where we're going to begin citations and cracking down. Also want to mention that if a store that sells a few candy bars is not a grocery store. So I think we all know the spirit of this, but right now we are aware of a few businesses that are trying to get around this closure order by, putting out some snacks on the counter. So we're going to go with the basic definition of a grocery store, which we can send out to folks, but basically 50% of the floor plan has to be food and groceries. So that totally works for convenience stores. So I do want to acknowledge there is certainly a role that our Circle Ks and our 7-Elevens play. They're fine under all of this. What's not fine is a smoke shop that puts out a few candy bars. So to talk more about that and some other problematic initiatives or areas in the city, our Fire Marshal, Gigas.
Hello, I'm Deputy Chief Gene Gigas, Fire Marshal for Albuquerque Fire Rescue. So as the mayor mentions, we are out there currently working with APD, code enforcement, and state police to enforce the public health order issued by the governor. All right, the one main concern that we have are the non-essential businesses that are still remaining open, which the order states that they are hereby directed to reduce their in-person workforce by 100%. So again, that is closing their doors. Okay, if other stores need to determine and need to figure out if they are an essential or non-essential business, they can go to the New Mexico websites, newmexico.org. Otherwise, I want to educate everybody on the severity of what the penalties are for if they are cited. So criminal penalties based off of the order are $100 or up to 6 months imprisonment. Again, we want to take this really serious. We're trying to protect your families, and our community. So civil penalties could be up to $5,000 for each situation that you are cited for. So these are, again, very serious. We take this as a serious matter. It is, we're trying to protect our family and your family. We have gone over the last week. State police has been the last 2 weeks of going around the city, taking complaints, visiting these stores. We have reported over 70 businesses to state police that we have found in non-compliance. As the mayor said, there has been the large number of them have been massage parlors and smoke shops. We have had other ones such as barber shops, beauty salons, gun shops that, again, they're non-essential. Again, we're not here to be the bad person. We're just here to keep you safe. We need to slow this virus down. And this is the way that we're going to do it. Other stores that are deemed essential, again, they're stepping up. Walmart's, Home Depot's, other large grocery stores. They're minimizing the amount of people that are in the store. They're maintaining the 6-foot distance inside the stores. These are going to help slow down that progression of the virus. That's what we're hoping for. And again, I applaud those stores that are stepping up on their own and doing that without any other direction. So this is where we're at right now. And we're asking for everybody to help us out. So the City of Albuquerque and the Albuquerque Fire Department's Fire Marshal Office, we understand the hardship the public health emergency order puts on all of you. It puts on the businesses, puts on the owners, puts on their families. But only doing this together can we achieve our goal of slowing this down. Thank you.
Okay, and with a little bit more on that and what's happening on the APD side of this equation, Lieutenant Sean Wallace from APD. Lieutenant?
Good afternoon, everyone. Like the mayor said, I am Lieutenant Sean Wallace, Homeland Security Division Commander, and what I'm going to be talking about is first we're going to talk about where we're at with enforcement, and then secondly we're going to talk about what we're doing in response to COVID-19. When it comes to enforcement, we have in place, the process is if we get a call about a business, first thing we do is our dispatchers will actually call that business and remind them of the governor's order. If we get a second call on that individual business, then what we will do is we will actually dispatch an officer. The officer will arrive on scene and remind them of the governor's order and notate that in the CAD. The third thing we will do, if we get a third and subsequent call about that business, is we will send an officer. They will, again, remind them of the order. They will write a report on it, and it's forwarded to the governor. One of the changes there, moving forward as we work through this, is we will now be working with the state police, the fire marshal's office, and our officers in the streets to provide enforcement action as given the authority by the mayor and the CAO. Please understand, we're not excited about this. We understand the anxiety, the frustration, and the stress that this whole event is causing everyone. Please work with us as we try to work through it. We're not trying to come in and take over the city. What we want to do is we want to try to, again, limit the spread of this virus. In regards to what APD is doing in response, first and foremost, we are working with our state, local, and federal officials to do everything we can to provide equipment and personnel to those that need it within the metro area. We've had a great working relationship with the federal partners, FBI, Secret Service, to name a couple. State-wise, we're talking about state police and Department of Health. Department of Health has been huge in supporting our operations. We recently were able to set up a law enforcement hotline that we could call in to get information in regards to people that we were dealing with, which, again, when we're talking about stress, fear, anxiety for our officers is huge, because then if they're infected or they're exposed in a high-level area, they have the potential to take that home. From a department standpoint, we've created a Department Operations Center, or a DOC, there at the main. The reason for this is we still have the Real-Time Crime Center that has continued to support the men and women in the field. We now have an operational center that is strictly there to help us maintain situational awareness. The chief or a member of his staff can go down at any point and see exactly where we are on the board. Another thing we have done is we have 3 people assigned to the EOC out here. They are virtually commuting. We have 2 lieutenants and a commander that are rotating through. The importance of that is just making sure that we have somebody on call available and that are always working in conjunction with the EOC. We've also issued PPE, or personal protective equipment, to all of our officers and detectives and some of our civilian staff that may have high-level exposures to individuals in the community. Our main focus in doing that is we want to make sure that we're preventing our personnel from taking this home and having community spread amongst the people in our organization. Another thing that I would like to bring up is we are working closely with the city security personnel. They've been a huge help. They're standing up. They're helping us direct traffic and provide security at places like Loveless, mobile testing and screening, the Presbyterian site, which was stood up. Without city security, the impact on the manning would have been huge with our department. So again, thank you to Jason Downing and his folks for really stepping up and helping us. When it comes to our officers, we're trying to encourage social distancing, personal hygiene, and the use of the PPE, the personal protective equipment. The big thing is, again, I know from a law enforcement standpoint, we teach our officers to stay together, to congregate together, and to them, this has been really challenging to get officers to understand the social distancing. But again, the effort is to, like everybody's talked about, to prevent that community spread. As we work through this, please remember that the only way we will get through this is working together. It's been an awesome opportunity to see everybody in the community, the different agencies come together. The big shout outs from the Albuquerque Police Department are Loveless, Presbyterian, and Department of Health. They have been instrumental in helping us put together our response and protocols to make sure we take care of our officers and personnel. Again, before I end, the last thing I really want to talk about is one of my units, open space unit. Over the weekend, they were sending me pictures of Montesa Park. I know we'll get to this at another time, but please, folks, if you're going to go out there, please maintain your social spacing. It's not time to barbecue with 20 or 30 people. It's time to make sure that we prevent this from spreading. As the mayor has said, we will be ramping up enforcement as we go forward. Last but not least, please take care of each other and take care of yourself.
Okay, thank you for that, Lieutenant. And reminder, tomorrow we're going to have that open space unit actually at our 11:30 briefing. So just to be clear too, specifically smoke shops and massage parlors, you need to close today or we are going to close you. That's where we're at with those types of businesses that are flagrantly trying to get around this order. Okay, the last piece we want to touch on is how to help. Lieutenant Fox actually is going to come back up and talk about some volunteer efforts and how to help. Lieutenant?
So as Mayor mentioned, just wanted to let you know that you can donate. We're having a lot of local businesses stepping up in a time of need. Because they're having to close, we're getting folks who are calling up here and donating gloves that we can use, safety glasses, N95 masks, surgical masks, anything like that. If you're a local business and you're not in operation and you're willing to donate that, please call the Emergency Operations Center at 244-8601, only if it's a donation, and we will get you to one of our service centers, which are located throughout the city. We have 4 in 4 different quadrants of the city, and we will get you in touch with them, or if it's something that we can issue out through the EOC, we will make arrangements to pick it up or have you deliver it here. If you're willing to volunteer, please look for volunteer opportunities at cabq.gov/abq.volunteers and sign up to volunteers. This is going to be a long duration operation, and we're going to need folks who can help us out. So we're building a list of folks who are willing to come out and help and work through this, who aren't working and who can help us in this time of need. So again, thank you to local businesses. Things we're looking for here in the Emergency Operations Center are hand sanitizer, masks, and surgical gowns. Anything outside of that as it pertains to food, care packages, or volunteers, we will put you in touch with one of the 4 service centers located around the city of Albuquerque. We do need your help, so please let us know if you are able to help in any of those ways. Thank you.
Okay, and to wrap up, a reminder, we do have a Spanish language session available after with Alcalde Armijo, so stay tuned for that. We also have our Spanish Twitter account for folks to follow at home as well. All right, and then lastly, our myth busting of the day. There have been a lot of rumors around what's happening with respect to law enforcement and APD. Just want to remind folks, there are no roadblocks or stops to check for coronavirus. APD is not doing that. We have even checked when people have called and said that and looked at whether it's lapel camera or duty roster records. That is not true. It is not happening at APD. And so just want to be clear about that. And with that, let's move on to questions. Takeout yesterday was Ty Baron. Excellent. On the west side. Okay, questions?
I have a question, Mayor, about crime in general across the city. As you're familiar, we had a homicide overnight. Gilbert says the total is now 19. This might be a question for you too, Lieutenant. But what is the city doing now, on top of everything else that you guys are dealing with in terms of the coronavirus pandemic, to continue to address violent crime and the homicide rate?
We're working primarily on 2 initiatives with respect to violent crime, and the first one is we've really decentralized how we're dealing with violent crime and crime in general down to the area command and hopefully even the neighborhood level. So basically there's a coordination setup that we do every Wednesday where we go through specifically tactically areas that we think are high likelihood for violent crime. And that is mapped out to our violence intervention team, which has now is in just the beginning of actually starting. This is something we talked about. It's something the state helped out with some funding for. That actually just started for the first time over the weekend. And so that has to do with trying to disrupt the retribution of those crimes. And so that actually was up and running for the first time last weekend. So our city's continuing on those efforts. We know violent crime was the #1 problem before Corona, so it's going to still be a problem, but I think now we've had a little bit of time to get some of these efforts up and running, and hopefully over the long run, that's going to make a difference. Okay, other questions? Yeah.
We have a few from the journal who's watching remotely. One, what is the protocol to determine which agency, whether it's city police, state police, or city fire, responds to complaints about
So I might ask the fire marshal to touch on that in just a minute, but in general, enforcement's being handled by the state police. Where we are helping is in specific areas where there seems to be a much higher demand. That would be smoke shops, massage parlors, and again, large gatherings. So that's areas right now where APD is stepping up. Otherwise, we need APD focused on violent crime. Anything else you want to add to that, Marshal?
Yes, we are working all together as a group. Depending on what agency gets the complaints, we will send an officer out there to educate and, if necessary, cite or bring APD or state police in so that they could cite those businesses.
The second one from the journal is, how many businesses has the AFR visited multiple times for non-compliance?
The second question is how many businesses have we visited multiple times for non-compliance? Excellent question. That one is of a level of detail we'll probably have to follow up with you, but I'm sure we can get you that info, so the marshal will follow up with you on that. I think we had one over here. Did I see a hand? No?
Just as far as like social distancing at parks and large gatherings there, I mean, what's kind of like the punishment for individuals, you know, who may get caught for having these large barbecues or whatever at parks?
So the question is, you know, what about sort of overcrowding at parks and lack of social distancing? This is a very different category than what we've been talking about today. Look, if we see something out of hand, we'll nicely tell folks to break it up and separate. I think actually Albuquerque's done a great job of this, and with the exception of these kind of potential for block parties or that kind of thing, that might be a little different. Well, there'll be an associated level of enforcement that we would in any case if those aren't permitted or if they're doing things with illicit substances like drugs and alcohol. So that's really what we're focused on. Other than that, we're asking folks just to really respect the rules, and we'll always just tell folks nicely to move on.
Another question back to the nursing facilities and the retirement communities. Any idea about how many of these facilities around the city you guys are gonna now have to go in and start inspecting? And then also, with the situation of Demenna, the executive director mentioned that the problem that they're having is these private caregivers coming in and exposing the residents. It's not necessarily with their own staff. So can the city or even the state do anything to block these private caregivers from coming into these facilities? Because from what I understand, there's kind of a loose definition of these private caregivers being able to go into these places.
It's a question is around the nursing homes and especially this private caregiver challenge that they're having and that they've voiced that makes a lot of sense why that's a challenge. And I'm going to queue up either Ryan Mast or Dr. Demenna to cover how many there are and so forth. I think Ryan Mast will take that in just a second. A couple of things that I would mention. Number one, we really want them to follow the same protocol the city is now doing. So they can use the fever check, ask the associated questions, and then just not allow folks. We believe they can do that already. Now, these are private businesses, so the enforcement on that is sort of a separate question, which we can talk about, but that is something certainly they should be doing right away. The other thing is there's lots of social distancing that they can enforce in their building, and that's what we're really checking on too. We got to make sure they're doing their part. Now, for more details on that, we're going to go with Dr. Mark Demenna back again.
So as you can imagine, there are sort of different levels of facilities. My understanding is we have roughly 150 to 160 facilities based on the number of permits that we have that we're going to be reaching out to talk to. In terms of any kind of enforcement for private caregivers and that type of thing, I mean, obviously we don't want the facilities to exclude those people just out of hand. There are obviously a need for them to be there. The facility will have some shared responsibility in making sure that people who come in to deal with their residents are following all the proper protocols. And where there's any confusion about that, that's where we're going to be trying to provide some outreach, just clearing up what needs to be done, what exceptions, which is very few, can actually be made in that, and just making sure that they're really clear on what they can and can't say.
Other questions? Okay, I think we'll say goodbye for today. Want everyone to stay safe and stay healthy, and we'll see you again tomorrow for what likely, unless something else comes up, we'll be talking about open space and solid waste and spring cleanups and so forth. Thank you.